Did you have Invisalign therapy and now you have gum recession? Do you feel that your gums are naturally thin? Can you see the root surfaces through your jawbone? If you have considered orthodontic therapy or Invisalign, your situation can become much worse. It can lead to recession post-orthodontic therapy. Please be sure to consider SFOT, surgically facilitated orthodontic therapy, prior to getting Invisalign. This will help set the foundation of thickening your bone and thickening your gums while you're going through Invisalign therapy. By doing so, you will minimize any after effects of orthodontic therapy. This patient was interested in correcting his mild malocclusion. However, he was referred to us due to his existing recession. The dentist did not feel comfortable moving his teeth knowing that this patient had existing recession, and if they were going to move the teeth, this recession was going to get worse. For mild malocclusion cases, Invisalign therapy or clear aligner therapy can take anywhere from 6 months to 9 months. In this case, we were able to complete it in half the time. But not only was the time an extra bonus, we were able to cover the roots of the teeth, address the thin tissues, and thicken out this patient's existing bone structure. And how we were able to complete this is with SFOT. It's a combination where the surgeon, the periodontist, works very closely with the individual that is moving these teeth, the orthodontist or general dentist. Together, these two procedures go hand in hand in addressing for patients that have thin bone, thin gum, recession issues, and want to cut their treatment down in half. For this case specifically, you can see where it's showing a little bit more yellow right underneath his tooth structure. That's the roots of his teeth showing. This is happening because he's lost the bony structure that's supposed to be in this area, and the gums that cover that have started to drop down. This is what we call recession. Here's another area where we're not seeing the yellow because the patient has had a restorative material, filling material placed over the root surface to protect it. However, the recession is there, and you can see it's continued all throughout the mouth. Post-SFOT and orthodontic therapy, this patient now has all the roots covered properly, as you can see, and his mild malocclusion has been corrected. So if this patient continued through Invisalign therapy without addressing his existing recession, all these areas would have gotten worse. With SFOT, we're able to fix the existing recession, realign the teeth, and prevent further recession from happening. I see on the internet a lot of patients that complain they had Invisalign therapy or teeth movements and now they have recession. Make sure you talk to your dentist about ways that you can actually solve the problem before you move the teeth.